Nosebleeds can happen for a variety of reasons. There are factors that affect the nose itself and factors that affect the whole body. Those that affect the whole body can include the blood being thin, either because you're taking medicines such as aspirin, clopidogrel, rivaroxaban, warfarin, or the blood pressure, for example, is high. And then there are factors that affect the nose. Could be some trauma to the nose. We often see rugby players that come with a nosebleed, or even the occasional person that's picking their nose up too much. Of course, there are certain conditions that affect the nose that can make the lining of the nose more irritated, infections, vasculitis, whole range of conditions that can cause the nose to bleed more likely. So those are the sort of things that can happen. As we know in our stressful lives, certain behaviors and things that happen to our body can occur. Primarily, the issue with stress is it raises our blood pressure. And a bit like a plumbing system, if the pressure in the system is high and there's a potential of a leak somewhere, then a nosebleed can often ensue. Of course, there are certain behaviors that we ourselves have. I'm sure I have certain habits and fidgets that could affect the nose. And I've certainly seen patients that play with their nose a little bit or pick their nose. I won't demonstrate that one. And all those sorts of things can certainly trigger a nosebleed. When we approach things as a doctor, we're always looking for a reason behind what's the cause. Because if we can get to the reason, then we can often stop the problem. Of course, we see from time to time patients do have nosebleeds for no apparent reason. I think in medicine there's two types of no reason. Either there's generally no reason, or we haven't found the no reason. And often it's our job as clinicians with our knowledge to try to work out what the underlying reason is where we haven't understood before. So that's a really good question. I mean, thankfully, the vast majority of the times, nosebleeds are fairly innocent and self-limiting. Of course, if a nosebleed doesn't stop, for example, after first aid measures, 15 minutes, it's not stopped, and the flow of blood is quite high, or you've got other comorbidities, then of course you need to seek medical attention. So there are two times or two time frames that you need to see a doctor. Sometimes you need to see doctors that day, urgent setting. You need to go to emergency room, for example. And in those cases, the nosebleeds that are just not stopping and losing a lot of blood, you're not feeling very well, you're feeling lightheaded, you feel like you're going to faint, there's a lot going down back into your throat, or there's other comorbidities going on, then certainly you need to see a doctor that day. And then there's the intermittent troublesome nosebleed that happens every day or week or every few weeks. There's just, you're not getting on top of it with simple measures. And those ones you need to see on a more elective basis, so an outpatient appointment basis. So there's two different ways of time frames to see a doctor for this. So that's a question I often get asked, and I'm always surprised how people often do something quite different. I see it on the television watching a football match, and I'm just wondering what's happening. So the first thing to do is to pinch your nose in the right place. Do not just pinch the bony part of the nose at the top. That's not going to do anything. You might as well just put your finger on top of your head. It will be of no value. So you need to get to, I remember my old boss used to say that compression is the mother of hemostasis, hemostasis being blood stopping. So if most of the bleeding vessels at the nose are right at the front, so we want to get to them. So what we do is we squeeze the nose. Thankfully, I've got quite a big nose, so you can see quite clearly. Use your thumb and forefinger as far back as possible around the nostrils and squeeze as tightly as barely comfortable. And squeeze that hard, really hard for 10 minutes. So, 10 minutes on the clock, not 10 minutes what you think might be 10 minutes, because often when it's distressing, 10 minutes, goes quite slowly. The next thing to do is do not just lean back, because then the blood, which clots, will go into your throat and feel very uncomfortable. You want to lean forward so the blood's coming out. The third thing to do is get some ice, perhaps some frozen peas, put them on the bridge of the nose to try to constrict the blood vessels. I often, with children, adults can have it too, put an ice lolly in the mouth so it constricts the vessels going up from the palate, but also calms the person down, which may drop their blood pressure a little. And the fourth thing you can do is get a medicine called Otravine or oxymetazoline, which squeezes blood vessels. And when you get a nosebleed on that side, squeeze a few, and it causes the blood vessels to contract and slows the bleeding down. So that works the vast majority of times.